Hello, and welcome to this episode of In Discussion With from Medical Update Online. Today, I'm talking to Paul Rutter about differential diagnosis and clinical reasoning for non-medical prescribers. Please, could you start by introducing yourself?
Yeah, my name's Paul Rutter. I'm the Professor of Pharmacy Practice based at Portsmouth University.
And can you give us a brief overview of what your job involves, what your current role is?
Yeah, my job at the university is predominantly teaching, but also to promote the profession within the university. So my main area of interest is diagnosis for pharmacists, and I teach most of the curriculum around differential diagnosis of minor conditions.
Now, I believe that your career started in community pharmacy. So how did you make the move into academia?
Yeah, that's right. I was a community pharmacist. I trained at Bradford University, did a split pre-reg with Bradford, both at hospital and community. Really enjoyed community pharmacy and interacting with patients. And I spent a number of years as a pharmacist before moving towards an academic career. I was lucky enough to be a teacher practitioner with Boots the Chemist, which whetted my appetite for teaching. Really enjoyed the teaching side of pharmacy, and over a period of years became more at the university than in clinical practice, to the point where I made the decision to work in academia full time, gained a PhD, and then started my academic journey bizarrely. And my first job was at Portsmouth University, and now I'm back at Portsmouth University.
But I understand that you gathered a lot of useful experiences on the way.
Yeah, I've had other jobs. I worked at Wolverhampton University, so I helped to set up the new School of Pharmacy at Wolverhampton and spent quite a long time there. And then I had a fairly short stint at University of Central Lancashire at their School of Pharmacy before finally returning back here as the Professor of Pharmacy Practice at Portsmouth.
Now, you are perhaps best known for your book on symptoms, diagnosis, and treatment in community pharmacy, the sixth edition of which I believe will be published next year in 2025. But your new book on differential diagnosis has just been published in August this year. And this is what I want to talk about today. So, first question. Can you explain why there is a need for another book? What need was this addressing?
Great question. And why another book? Yeah. The main book, as you said, the sixth edition comes out in about April 2025. But this particular book was driven by the need to try to fill a gap that my current book, doesn't fill. We all know that community pharmacy is expanding its role of practice, becoming more clinical. We all know that we're going to have a prescribing workforce by 2026. All graduates will have that IP qualification. And this book is trying to address that extended role for pharmacy. So it's looking to serve the purpose of meeting that need, where pharmacists will be expected to be doing more, and therefore the need for them to understand how to differentially diagnose signs and symptoms in a different way compared to how traditionally pharmacy students have been taught has been, for me, created that need for the book. And we look at using a case study based approach, but using clinical reasoning as a method to elicit information from the patient.
But haven't community pharmacists already got a tool for this sort of thing? What about WHAM, WWHAM?
Yeah, we've had a number of different tools advocated for pharmacists to get information from patients. WHAM is probably, the two WHAM approach is probably the most well-known, and the one which a lot of employers will get their staff to use to get information from patients.
Could you just remind us what WHAM stands for?
2WHAM. So forgive me here, I'll just try to remember. Who is the patient? What are their symptoms? How long have they had the problem? Action that the patient's taken, and medications that the patient is taking. Now, in itself, that tool is a good basic information tool to get some data from the patient. The problem is it's not a very good diagnostic tool. If you think about the questions that it asks, at least 2 of those 5 questions are more to do with management and treatment planning rather than the diagnosis. So it doesn't actually ask many questions to establish the differential diagnosis. For that reason, it has been criticised as not being good enough for the current workforce and the future workforce. When it was first introduced, it was great because it was new and it was one way of getting information from patients. Clinical practice and the role of pharmacy in the community has moved on. And I think we've evolved beyond the 2WHAM approach. And because we are now being expected to do a lot more in pharmacy, we need to adopt new ways of thinking and new ways of getting information from the patient. And that's where clinical reasoning comes in. And that's the focus of the new book, is how do we use this clinical reasoning tool in order to establish a differential diagnosis. And that's fairly new for pharmacy.
So does 2WHAM still have a place, or is it considered to be out of date and not fit for purpose any longer?
I think it still has a place, but the place isn't for pharmacists to use. I think because it is a reasonably good tool to get basic data, then those who are not pharmacists, so your counter assistants, people who work front of shop who haven't got as much training as the pharmacist, it's still a good tool to get some basic data from. And that basic data can then be given to the pharmacist, who can then take that forward with the patient and get more information from the patient to try to establish what's wrong with them.